Good morning. It is now July 11th, 2024. I'm Dr. Deuk shot. Our patient has 2 herniated discs in his neck. We've already evaluated him with a MRI review, 2, 3, 4, 5, 6. You agree? So I want to be a little bit higher. The disc herniations are at 4, 5, and 5, 6. I can't really see you, Luis. There we go. Shot. He had the choice to have fusion done. He chose not to. And we're now doing the laser surgery, the Deuk laser disc repair. Shot. Perfect. AP. The laser surgery that we perform here is arthroscopic. It's done with a little camera and a scope. Quickly. Perfect. It's a little bit too far to his left. So I'm going to correct that. Go back to a lateral quickly. And we are not putting metal in his body. 2, 3, 4, 5, 6. Shot. AP. Quickly. So I'm holding pressure on the spine through the skin, and I'm placing a needle percutaneously a little bit too far to his left. I'm going to fix that. Shot. AP. Let's see if we're more in the middle. He's got a nice supple neck. That's perfect. We're right in the middle. I'm going to enter his disc through the front wall called the anterior annulus. And the first thing we're going to do is a discogram. Shot. Now we are at 2, 3, 4, 5, 6. Count for us. No, using the white arrow so the audience can see. Okay? 2, 3, 4, 5, 6. Shot. We just injected some dye. Perfect. Show us the tear with the white arrow. See the tear in the back of the disc? It's humongous. It's the big black streak. There shouldn't be there. The dye should stay in the middle of the disc like a little cotton ball, but it's leaking out through a tear in the back of the disc. Shot. All right, perfect. So now we have done our discogram. We've accessed the disc through the neck. We're going to make a tiny 4mm incision. We're going to perform the entire surgery arthroscopically through a 4mm incision. Our patient is from New Mexico. Seriously, what? Henry?
Yes, sir.
All right. So there's the incision. Now, he's had surgery before with a metal plate on his clavicle, I believe his shoulder area. You could see it in the x-ray. He didn't want more metal in his body. I don't blame him. He wanted a more natural solution for his discogenic pain. Basically, he has 2 herniated discs in the neck. As soon as you see me do something and I'm looking up, I need feedback from you, okay? So watch my eyes, watch my hands, feedback, okay? Just take shots so I can see what we're doing. Henry, let's show the audience, how is it that a herniated disc in the neck can be so painful? Shot. Perfect. Let me have a little betadine. Okay, you guys see the AP view? Henry, show the x-ray.
Copy that.
On a 4x4, little betadine. You guys,
We saw that.
All right, you could see that there is a tear on both sides of the disc. You could see that we were in the middle of the spine with the tip of the dilator, which is exactly where you want to be. Okay? Good. Any questions from the audience?
At this moment, no current questions.
Excellent. We're going to start at C5-6. We're going to work up to C4-5 next. Shot. At this point, I'm pushing the dilator through the anterior longitudinal ligament, through the anterior annulus fibrosus. We are in the disc now. Now note, there's no cutting of the annulus. There's no damage to the disc. We're passing through the middle of the disc at this point, called the nucleus. The nucleus is basically water and proteins. There's not much structure to it at all. So we can pass through it without harming it. That's it right there. Can you fix the orbit? You're off about a degree. Just try it both ways if you have to, if you're not sure. I don't need anything. I think let's try the other way. Let's see. I don't know, more. I feel like we're getting worse there, right? Yeah, we're getting worse. Go back 3 degrees the other way. Shot. That's perfect. Okay. We're off by half a degree, but it's good enough. Good enough for government work. At this point, we are passing through the disc to the tear in the back. Show us the tear in the back. Monica. Just, yeah, you can see the tear and the herniation coming out the back of that disc. That's the black line. You got it. Thank you. We've lost 1 drop of blood. This is a bloodless type surgery, the endoscopic Deuk laser disc repair. Shot. Now, before I started doing these surgeries, I had learned how to do artificial disc surgery and fusion surgery. And that's what I was trained mostly to do. But when I learned the endoscopic surgery over in Korea and Germany from the people who developed it, I realized that this is a pioneering technology that's going to improve care for patients, because you're not taking the disc out to get to the herniation in the back. So you preserve the natural disc. You're actually just basically removing the part that's causing the symptoms, which is the tear. Shot. You're cleaning the tear, you're removing the herniation. That allows the disc to heal naturally. And there's nothing better than natural healing in the body, right? Shot. So to avoid putting in metal, whether it's an artificial disc or a fusion, this is the surgery you do. There is nothing else that works, and there's nothing better. This is the least invasive, smallest incision, fastest recovery, least amount of blood loss. I don't think we need to get these outside of those. Lowest chance of complications, and the most successful at eliminating neck pain, headaches, and radicular symptoms or myelopathic symptoms. It also gives the surgeon the best view of the pathology, which is why we're here. Pathology means the part that is wrong, that's broken. And guys, is the irrigation on? I don't see it.
Stop. Irrigation.
Come on, guys. Let's pay attention. All right. Any questions from the audience?
At this moment, no current questions.
All right.
In the meantime,
Audience participation sucks pretty bad.
yeah, we do have viewers coming on from all of our social media platforms, but no one's just asking questions. So in the meantime, can we show them how?
All right, audience. Yeah, I think it's a great idea, Henry. We can show them one of our videos. But audience, this is Dr. Deuk Majin. You guys can ask questions. We're here to answer them for you. Our patient's surgery is going very well. We're not having any problems. And because of that, things are going very smooth. I think it's fine for you all to ask questions of me. I'll do my best to answer them, okay? In the meantime, go ahead, Henry. You were going to show them a video.
Yes, to show them what it is that we are doing and how the DLDR actually works.
Awesome. Thank you, Henry.
Of course.
Excellent, Henry. Thanks for showing that. That is the Deuk laser disc repair, the surgery we're doing right now. We use a laser, which you guys can see there, the glass fiber coming out of the blue plastic coating. That is glass laser fiber. It is a fiber optic, I don't know what you call it, cable, fiber, fiber optic fiber, but it's basically glass and it transmits light or electromagnetic radiation through it. And it's basically what's used to, transatlantic fiber optic cable for, the internet, for communicating, telecommunication. They've been using it for years, and there are these huge cables of glass fiber across the oceans connecting all the continents, and that's how we're able to access websites and content stored on servers in other countries, in other locations far away. So we use the glass fiber to transmit laser energy from a laser called a holmium YAG laser. And the holmium YAG laser is a medical grade laser. It's designed for medical purposes, like surgery, like what we're doing right now. It's completely FDA approved, and the fiber is FDA approved, the application is FDA approved, everything we're doing is FDA approved. FDA is the Federal Drug Administration, and it regulates everything in medicine in the United States. And this laser is regulated by the FDA, and the good news is they approve it, so we can use it to do what we're doing today. All right, any questions?
Yes, we have a question coming from Patsy on Facebook.
Cassie.
Patsy.
Patsy.
Yes. Patsy
right.
asked, how long is the recovery?
Great question. For this surgery with the 4 millimeter incision, the recovery is 1 hour, just 1 hour. This patient will literally go home in an hour, and he's from New Mexico, so he had to travel from New Mexico to Florida. That's a good 4-hour flight on the plane. So he's going to spend the night in the hotel and come back for a quick checkup tomorrow. Then he's going to go home on the airplane. But basically, it's a 1-hour recovery. That's all. Now, you can go have dinner, you can go shopping, you can go work the next day. You can go to work the next day. Some people will go to work the same day. I don't recommend it, but they will do it because we use really good anesthesia, and patients are feeling pretty good within a few hours of their surgery. Oh, there's a herniation right there. And he has a type of job. He's the horse whisperer we talked about. He actually came and got his back fixed as well as his neck. And so we're doing 2 surgeries. Today is his second surgery. We did his lumbar the other day. He has some facet pain still on his back, which we haven't treated, but He had 2 discs in his neck that were torn. You could see the tears. I'm cleaning them out. This tear will take 1 year for it to solidly heal. Okay? But he will be recovered way before 1 year. He's going to recover from the surgery by tomorrow. Now, will he be pain-free tomorrow? We hope so. That's what I expect. He's not going to have any neck pain tomorrow. So, great question. Thanks for asking. A lot of this here is scar tissue from the herniation. And there's still some herniation here. I'm trying to remove as much as I can. It's impossible for spine surgeons to take all the herniation out. The best we can do is usually about 80%. Maybe I got lucky one time and got 90%. But you don't need 100% to get rid of the patient's symptoms permanently. You just need enough. It's really a debulking procedure. It's not a tumor, it's not a cancer or anything where you have to get as much out as you can. I mean, you want to get as much out as you can, but when it comes to cancer, right, it's going to grow back. But herniations, these herniations, they don't grow back. They can re-herniate if the patient doesn't follow their instructions. But in general, they're not tumors. They're not made of cells that grow over time. So a herniation is just where the center of the disc squeezed out through the tear, and we're cleaning this tear so that it will actually heal. Thanks. We're almost done here with the first disc. For those of you who have never seen this before, the bottom of this tube right here is the back of the disc at C5-C6. This is the neuroforamen. This is where the nerve root lives, down there. And the laser is doing a really good job of removing herniation from the back of the disc where the problem is. Any questions?
Yes, we have a question coming from Sean on YouTube,
Yes, Sean, happy to answer your question.
asking, how do you treat multiple whiplash injuries?
How do you treat multiple whiplash? Great question. So, first of all, for those of you who are not sure what we're talking about, a whiplash is where you have trauma to your neck and your neck whips. And the first thing that usually happens is people get sore muscles. But during that whiplash, there's a piece of herniation. You can actually injure your disc and your facet joints. And muscle pain from a whiplash goes away in a few days. You don't need to do anything for it. But when you have pain that keeps going past a few days, then you have more than a muscle problem. You have an injured joint. And the first thing we're going to do is figure out where is the source of your pain. 30 seconds on this disc. After we know the source of your pain, let's say it's a herniated disc, then we're going to go and fix it with this surgery right here. The most common cause of neck pain after a whiplash is a herniated disc, just like this patient's right here. So this is what we'd probably end up doing for you. The second most common cause is what's called facet joint pain, which is little joints in the back of the neck, in the back of the spine. And they get injured with whiplash, and then people have facet pain, F-A-C-E-T. So, Henry, do we have a video animation on facet pain we can show?
Yes, we do.
Okay, so you can see from our video that besides the disc, there's another cause of neck pain called the facet joint. Let me show you this piece of herniation I just took out. Can you guys see this?
Yes, we can.
You have a measuring? Right here, Henry, is that good?
Yes, sir. Yes.
So we're just about finished, and then this guy popped up. He's about 5 millimeters long and about 4 millimeters wide. And we're going to send this off to the pathologist. All right, we're done. Let's have some irrigation.
Yes, sir. Scope off, please. Thank you.
So one disc is fixed. We're going to go fix the next one because this patient has 2 discs. But to answer your whiplash question, we want to make the diagnosis. Is your pain in your neck from the discs or the facets or both? And the way to make that diagnosis for you is through our free MRI review. Deuk Spine is a world leader in diagnosing the cause of neck and back pain. And we have a video coming out in the next few weeks. You'll see that there are 30 potential causes of chronic neck pain. Chronic neck pain is pain lasting more than 6 weeks. So when you have a whiplash, come on in, you hurt your muscles, well, the muscle pain goes away in a few days. So if the pain is lasting longer than a few days, if it lasts 6 weeks or longer, it's called chronic neck pain. And there are about 30 causes of chronic neck pain, but almost all of them are the disc. About 85% of the time it's a disc injury called a herniated disc, bulging disc, ruptured disc, protruding disc. And we're going to do this surgery to fix that. More north. More north. More north. More north.
The tube is there.
All right, any other questions?
Yes, we have a question
Come on,
coming
Monica.
from Raj on YouTube
Hello, Raj.
asking,
Shot.
"Hi, doctor. Do you accept
Come
Bupa Global
You've got
Insurance?"
to move forward, Monica. That's wonderful. All right. Somebody figure out why her fluoro's caught. Do we accept global insurance? We accept any insurance that pays. There we go. All right, 2, 3, 4, 5, 6. So we got to move up 1 disc. We accept any insurance that pays. I think if you called your global insurance and asked them, will they pay? They may be able to tell you, but it's not something we can do. What you can do is if you're global, coming from international, you pay cash. We have a cash rate shot. And then we can bill your insurance, or you can bill your insurance and try to get reimbursed. Shot? 2, 3, 4, 5, 6. All right, so we are finished with 5, 6. I'm going to move the dilator out and slide north to 4, 5. Shot. And shot. We have a lot of international patients come. We have a very good competitive fair price for our surgeries. We want people to get well. Again, we're not going to shot. Let's get it fixed. Shot. I need an AP. Quick AP. Any other questions, Henry?
Yes, we have another
Let's go. AP.
question coming from Caroline on Facebook,
Shot.
asking, "Is there a way to speed the healing of the tear? Do you recommend modalities
Shot.
post-surgery that can speed up the recovery so
Lateral.
the patient can go back to his full load of activity sooner than a year?"
Yeah, it's a great question. I appreciate you asking. The answer is today in 2024, we don't have any way to speed up the healing. It's probably something to do with the... Are you getting an unusual x-ray look appearance? Shot? Shot? All right, perfect. AP? There's... Oh, I just slid. Shot? Shot, lateral. Shot. Okay, AP quickly. There's no way to speed up the healing. There's nothing in the world that will speed up the healing that I'm aware of. And you just have to be patient, lateral. You have to be willing to let your disc heal. The reason the disc heals so slowly is it doesn't have a blood supply. Okay? It only has a blood supply in the outer part called the outer annulus. And that certainly will heal faster, but the entire annulus will take more time to heal. 2, 3, 4, 5. Looking good. Let's get one more AP just to be sure. We're using the X-ray machine to navigate through the disc at C4-5, which is the next disc above the one we just fixed. Uh-huh. Shot. Somebody needs to fix the upper. I'm going to come out and try to recenter it. I need you to hold the head centered. Shot. I need an AP view. Let's get the head de-rotated, looking straight up. Quick shot. All right. Is that de-rotated? Yeah?
Yeah, feels pretty good.
Yeah.
Feels pretty straight.
Stay there. I'm not done. Shot. That's really good on the AP view. Lateral. Shot.
But not right now.
Is that it? Right there? Shot. 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 Uh-huh. All right, good. Perfect. Yeah, we're good. Henry, any more questions?
Yes, we have a lot of questions. This next one coming from Sean
Sean.
once more on YouTube, asking, does an
Sean.
MRI show facet joint injury?
Yes. MRI will show facet joint injury as long as the MRI is good quality. But the radiologist shot frequently do not read it. The radiologists ignore facet joint abnormalities at least 50% of the time. So you may get an MRI with facet joint abnormality. However, your radiologist didn't read it. They left it out. Okay? The fact is, radiologists do not read everything abnormal on your MRI. They don't put it in the report. If they did, they would spend hours on each report. They don't have hours. They get paid $15 an MRI. Imagine getting paid $15 for an hour's worth of work as a doctor. It would be shocking. But unfortunately, insurance companies pay so little nowadays that radiologists have to find ways to be more efficient with their work. Same thing with anesthesiologists. Do you know that Medicare, our government insurance company, the biggest insurer in the world, pays $88 an hour to an anesthesiologist? $88 an hour. Dr. Berndes, will you work for me for $88 an hour? No, he won't. He doesn't. And the anesthesiologists today, you know, they want a lot more than $88 an hour, usually 2 to 3 times that amount. And they deserve it, by the way. They should have it. But the problem is insurance companies have cut reimbursements so much that the quality of care, such as radiologist reads of MRIs, has gone down. Now, you used to pay an MRI $1,000 for an MRI. Now they pay $200, okay? So cost of living has gone up in the last 15 years. And $200 is not enough money to cover the costs of electricity, the cost of the machine, the cost of the rent. I'm really getting thrown off by that X-ray. Somebody fix that. Nikki, you're standing around doing nothing. You should be working on getting that fixed. Shot? I need a zoomed in view over there. All right, now it's working. What was the problem? Nikki, what did you do to fix it? So somebody had put it on the wrong setting.
They just probably said it, like change endoscope to fluoroscope.
But going from endoscope to fluoroscope means it was on endoscope. Or you said you shuffled it from fluoroscope to endoscope, endoscope to fluoroscope. All right, that's pretty darn good right there.
Press fluoro, both.
So, long story short, should the MRI show facet arthropathy? It does. Will the radiologist mention in the report? Not, usually not. Maybe 50% they will. Will that tell you anything you need to know? No, it will not. MRIs never tell you where pain comes from. MRIs never tell you where pain comes from. So that's why so many people have pain, because their doctor doesn't know where pain comes from. The MRI doesn't tell you where pain comes from. But Deuk Spine Institute has figured out how to determine the source of pain in every patient with neck pain and back pain. And it's through a process that we use, that I developed. And I can diagnose pretty much everybody's source of pain. I do it all the time.
This next is a comment from King Smooth on YouTube
Sure.
saying, "Good morning. I sent my MRI, but I haven't gotten a date for the review."
Yeah, I don't. Scope off, guys. Scope's out. Should be put off. We shouldn't have to tell you. So, King Smooth. The reasons you wouldn't have an MRI date is, number one, you didn't send us what we needed. We need DICOM images. And we need them, all of them, and we need them either through CD in the mail or through a portal that you've given us login credentials that we can access, or you've swiped them from the website, from your CD onto our website. All right? So it's got to be one of those three ways. So maybe that's the reason we don't have your images. I don't know. I'm just guessing here. The other possibility is you didn't send us your report of your MRI. But either way, in the end, if you've done everything you're supposed to do, you should have an appointment to do our Zoom. And if you don't, I would love to know if you can get us your actual name. I can look it up and see. Okay? Maybe Henry can get it, and I'll have one of my staff look and see why you have not yet been given an appointment.
Yep.
But every time I do this for people on the internet over this in this situation, I always find out later that, oh, they never sent us this or they never sent us that. We've asked them several times. They just didn't send it. Now, it could be that my staff are confabulating, which is possible, and that you've given everything you're supposed to, and they're just being lazy. But, you know, that's possible as well. So I'm open to all the possibilities, but I would like to know if you've sent everything you're supposed to send in. And I can check on that. Henry can check on that.
If yes, King Smooth, if you feel so comfortable to place your name in the comments, I can
Is there
take
any
that.
other way he can send us anything?
He can send it. I can actually, he can send it to my email if he feels so comfortable to do so. Just sending me the name, and then I can take it to the heads of our MRI review, and we can go from there. You just gave us their name. Okay. And so, no problem.
Talk to Lily
Okay.
and find out why.
Okay. Not a problem.
Yeah, we'll get an answer for you.
Of course. Until then, this next one is a comment coming from Mixin' On Up on YouTube, saying that they watched your 3-hour video of you performing a T-lift from a couple years back, and
Yeah.
what an amazing job. Your
thank you.
attention to detail was incredible, and patient had a very deep spine. The surgery looked very challenging.
Yeah, thank you. You're right, and I appreciate the fact that you can appreciate that I have great attention to detail. That's what makes me a good surgeon. That's what gives me great results with my patients, is that I do pay attention to the details. Because the devil is in the details. We've all heard that saying. It just means that if you don't pay attention to the detail, you're going to have problems. And our patients that we do T-lifts do fantastic. And the deep back is very challenging, you're right. And what they're referring to is the patient could have a lot of soft tissue, or they could just have a spine that's very far forward in their body. Our spines are not located in exactly the same place in every person. Some people have a spine that's very far forward. Some people have a spine that's far back. I prefer the ones that are far back, and if I'm going in the back, obviously it makes my job easier, but same thing for every other surgeon out there that operates on the spine. We like a posterior spine. That said, not many doctors even know there's such a thing as posterior positioning of the spine versus anterior. Something that I figured out doing lots and lots and lots and lots of spine surgery. But that said, I appreciate your comments, and yeah, we try to avoid fusions as much as possible, but some people need it, and we may actually have a fusion coming up soon. If you want to watch another T-lift, we have a patient we're trying to get approved for a 3-level T-lift right now from workers' comp, and that will be an L34, L45, L5S1. She has severe degenerative disc disease. She has scoliosis, kyphosis, and listhesis, spondylosis, and severe stenosis, and short pedicles. So she is not a good laser candidate, and she will need a T-lift. If they approve it, we're going to put her on, and we will be broadcasting it for you guys to watch. That'll be in the next few weeks. Look at that herniation right there. You guys see that? Coming out of the foramen?
Yes, we do.
Yeah. So this patient definitely needed it. And this right here is all scar tissue right there. That white stuff sitting on top of the ligament. Oh, look at that herniation that just came out. That was so cool. All right, we're going to have to grab that one because it's so big. So that was on the right side, patient's right side. So that would cause right arm symptoms. And if it wasn't causing right arm symptoms, it sure will. It doesn't matter of time. There it is. You guys see the herniation?
Yes, we do.
Now, what's interesting is look at the red here. Inflammation. You guys see that? That's inflammation. So this herniation is recent. It got stuck out there and caused a lot of inflammation, and that's where his pain came from. That's why he's here having this surgery. I bet you this one piece right here is the main reason he's here. Yep. Because there's typically in a herniation, there's about 30 pieces, and they happen over years. And then like it gets to a point where the patient's like, I can't take it anymore. And they come in, right? But usually we find that there's probably one piece of herniation that's responsible for that. And I think if you had to pin it on one, that's the one. All right. By the way, herniations are all different sizes, right? We've seen some small ones. We've seen some big ones. There's another one right there. Looks like he must have re-herniated sometime recently, you know? And this one has not yet gotten the inflammation on it. Also notice that it's white. It's not blue. If it was degenerated, it'd be blue. What white means is that the inflammatory system hasn't attacked it yet. But it's probably because there's so much in here, it's busy with the other guy that we already saw, right? The earlier one. But no, it's looking good. Oh, more of them. Man, he's got a lot of herniation. This is the 4-5. Each one of these is a herniation. I'm trying to break it up into smaller pieces to float it out easier. Oh, sorry, Dr. Berndes. I have 5 minutes at most. I should have told you. I'm getting stuck. You know why it gets stuck, Luis?
Can be two things. Can be that tube needs to be replaced, or it can be a scratch on the surface of the scope.
There's actually another reason. What is it? Could it normally get stuck? Huh?
Sometimes.
Why? It can, but why?
Because
What's the shape of the scope?
yeah,
Is it circular?
No, it's not circular.
It's not, is it?
sideways.
And neither is the tube.
Mhm.
So if you don't get the orientation of the tube and the scope proper, then you can have a situation where they're clamping on each other.
Correct.
You said you're changing irrigation? That's fine. Please do so expeditiously. All right. Oh, come on. Any other, can you get the irrigation changed, please?
Yes, we have a lot of questions. This next one coming from Lanu on YouTube,
Sure, Lanu.
asking about the annular tear. Can aging weaken the outer wall of the intervertebral disc?
Can aging weaken the outer wall of the intervertebral disc? No. Aging does not weaken the outer wall of the intervertebral disc. Did you get the irrigation working? Try to find out what it is that's going on over there so that you don't have to keep having this murder mystery at night where you have to solve a new dilemma every single day, okay? Those machines, believe it or not, they're machines. They just act like machines. They don't have personalities where one day they're angry, the next day they're sad, or depressed. They just perform the same way. You just have to understand how they perform and understand how to get them to perform consistently. This way we want them to perform, okay? Sam, do you hear me? You can't like have trouble with the irrigation every single surgery. We've got to solve the problem and overcome it. All right?
We have a couple more questions.
Sure.
Next one coming from Melissa on Facebook, asking, can you help with someone already fused with a C2 to T1 fusion?
Yes. Can we help somebody who's already fused C2 to T1? The answer is yes, we can. The first thing you need is a diagnosis, like what's wrong. And I have a feeling I know what's wrong. It's either your C1-2 joint, if you have pain high in your neck, 30 seconds, Dr. B. And if you have pain at the base of your neck, it's your T1 and T2 joint, your facet joint, most likely. So we can fix both of those types of pain. You just need to do an MRI review with me, and I will tell you what's wrong, and we'll get it fixed. All right, we are just wrapping up the last minute of this surgery, and I'm coming out. We're going to irrigate, and we're going to close up. I'm happy to take your questions if you have them. Henry, I'm going to come over there and answer those questions, okay?
Copy that.
So I haven't been in front of the camera in a while. Not that I'm camera shy, but I'm going to come over there and personally respond. Got one more little piece of herniation I'm trying to get rid of. And I think we're done. Yeah. All right.
CD on, please. Thank you.
Yeah, we are. Why? What's the issue? Scope view 7. All right, type your questions up. Henry, you want to go to a testimonial? And
Yes,
I'll be
sir.
there shortly to answer their questions.
Copy that.
Oh, we can show them real quick.
Yes.
We lost maybe 1 or 2 drops of blood the whole surgery. And let me show you guys the incision on his neck. 4 millimeters. That's his chin. Can you guys see this?
Yes, we can.
Let's see. You guys see it right there?
Yes, we do.
It looks like he came to Florida and got bitten by, it's right there, got bitten by a vampire with 1 tooth. Do we have 1-tooth vampires here? Just ones with bad dentists, right? All right, go to a testimonial. I'll be there shortly.
Copy that.
You got it, right? I'm here with my patient who traveled from California, Northern California. He had a herniated disc at C5-C6. It was a small disc bulge. He was told by the doctors in California that he should just live with the pain, give it time, and eventually he'll need a fusion. Is that right?
That is correct. I was told that within 5 years I would be needing surgery. So basically what they were saying, live with pain for 5 more years and then we'll do something about it. One of the things that I've seen a lot of the videos is testimonials, and I will always say, this doctor sounds too good to be true. And actually it is true. I appreciate you, doctor. I really think that is really nice procedure, and the staff here is really nice. They're always very friendly and kind to get you through the process, because when you get told so many times that that's your new life, it's kind of, you're always thinking, is really the way I want to live? If I'm going to live a lot of years, why wait with pain? You know, you need to do something different. And always, whenever you see videos, you're always a little sketchy and saying, maybe it's not true. Maybe this is not what it is really saying. But today, when I felt with no numbness and no pain on the neck and just going through the process, I really been blessed. I'll be flying to California today. I honestly can't say much, you know, it's a miracle. Whenever I heard the testimonials, they say you're a tool for God. It actually seems like that's the way it is. It's a miracle through you. God works through you, and it's awesome to feel better, you know?
I'm so happy for you and your lovely wife who's here with you. You can see you had a tiny little incision. You had the Deuk laser disc repair for your herniated disc. You can see we were in there with the laser, cleaning out that foramen on the right side where the nerve was being pinched. There were a lot of pieces of herniation in there. And the laser cleaned them all out, and your surgery went perfect, and here you are less than 24 hours later. Feeling good, huh?
Well,
With
yeah.
a smile on your face. That's what I like to see.
You know, it's a smile of happiness. It's a smile of joy, you know, that it is doable. And I think no one should be able to be living with pain. I was so happy to see testimonials when they used to say, well, the one regret I have is not going in earlier and living 18, 20 years with pain. For me, it's been 3 years since July of 2020. It's been miserable because I've been with pain. And I've been told by doctors, let's just take time. I did all kinds of physical therapy, acupuncture, you name it, everything that's out there, and nothing seemed to help. And today, with 1 day of getting something really that's gonna be for life, it's amazing. It's a smile of joy, you know? If you are going through this trouble, don't hesitate on sending your MRI. When I did it, I sent my MRI for free review, and my answer was, yes, you are a candidate. Here I am today, flying back with literally no pain on my neck and no numbness on my hand, which I miss that. It's awesome.
It's wonderful. Now, what is your native tongue? What is your native language?
It's Spanish.
Are you from Mexico originally?
Guadalajara, Jalisco, Mexico.
Guadalajara.
Yes.
One of my favorite songs. Can you tell them in your native tongue how you feel?
Yeah. Quisiera decirles que si están teniendo problemas con una hernia en su cuerpo, manden su MRI, es gratis y les van a dar un resultado, una verificación si ustedes son candidatos. No vivan con dolor, porque el dolor les va a causar toda la vida, y los doctores allá afuera les dicen que no hay solución, pero las soluciones existen, simplemente las tienes que buscar y creer, tener fe que tú vas a estar mejor. Si Dios te mandó a este mundo es para que vivas bien, no para que vivas con dolor. Así que te recomiendo que por favor tomes esto en serio, hagas ese paso de mandar tu MRI gratis y habla ya sea con quien tengas que hablar para que ellos te empiecen a guiar y te digan qué es el siguiente paso que tienes que tomar. Así que una recomendación con Dr. Deuk. Muchas gracias.
Muchas gracias, amigo. And Feliz Navidad.
Feliz Navidad. Gracias.
Safe travels, my friend. Thank you so much for sharing.
And good morning. I'm Dr. R. Deuk Majan, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who's traveled far to come to Deuk Spine Institute, all the way from Michigan. What brought you from Michigan to Florida?
I was scheduled for fusion to have just my one disc, C5-C6 fused. I'd had disc herniation before in my lower back, had it done. I didn't want to have to go through that again. So I did some research, found you had a good record. Your history is impeccable, so I decided to come down here and have it done.
Well, you didn't have a fusion, though. You had something else done.
Yeah, I'm sorry. So instead of fusion, instead of going through and the complications and risk of fusion, lack of mobility, I wanted to have laser. I talked to somebody in Mexico that had laser surgery, and she said it worked great. So I thought I'd pursue that avenue, and that's when I kept Googling and searching and trying to find the right place. Some places had bad references. You had impeccable record, so this is why I came here, and I'm glad I did.
Yeah. So you were recommended for fusion by another doctor, and let's talk about that for a moment. They were going to fuse one disc, right? Number 5-6?
Correct.
Now, if you go to your surgery video here, you could see that we made a tiny 1/4 inch, 4 millimeter incision. And we fixed 2 discs, not 1, but 2. And it turned out that the disc that you were not going to have fused was actually the worst one. It was the one that was causing the vast majority of your symptoms. And the reason I'm talking about this is it's a common problem. It comes down to being misdiagnosed. And misdiagnosis happens all the time, all over the world with spine problems. And that's what we're trying to fix, is not having patients get the wrong diagnosis, because the wrong diagnosis will lead to the wrong treatment. Because treatments are always based on diagnosis. So if your diagnosis is C5-6 disc, the treatment will be fusion of the C5-6, but that's wrong because you had 2 discs that were problematic. We fixed both. You could see in that video, we were taking out lots of little chunks of herniation out of your C6-7 disc. Definitely needed to be done. How do you feel today?
I feel great.
Yeah, do you still have the same neck pain you had when you came here?
No, my wife can already tell that my shoulders are relaxed. My neck, I feel great, so very comfortable.
And you had your surgery just 24 hours ago.
Yesterday morning.
Yep, and you can see you have a tiny 4 millimeter incision with a Band-Aid. No metal, no fusion, no narcotic painkillers after surgery. We didn't give you opioids, so that's another plus to the Deuk laser disc repair.
I agree.
Yeah, you don't need to be on powerful painkillers. You're back on your feet already, walking around, not in the hospital.
Yep, great. I'm glad I had a guardian angel looking after me.
You did have a guardian angel, and you're welcome. We enjoy helping people like you have successful spine surgeries. Is there anything else you want to tell your fans out there?
Basically, if you need this surgery, if you're having complications, neck, back, definitely come here. I don't care what it costs you for travel or whatever. You can't, it's worth, priceless.
I agree with you. It is priceless to get out of pain and have no complications from your surgery, and nothing bad that hurts you or harms you or changes your life in a negative way. So congratulations. And when do you guys head back to Michigan?
Saturday.
Saturday. So you're going to spend a few more days here?
Yes, sir.
What are you going to do for the next couple of days?
Well, we plan on hanging out in the sun, but
yeah,
it's not the case right now.
I think, yeah, well, you could do. Oh, yeah,
know,
it's a little overcast right now.
Yeah.
But this would be a good day for you to go check out the Kennedy Space Center. It's about 10 minutes away. They have all the displays and history of NASA, and it's really worth visiting.
I'll do that.
Save the beach for tomorrow.
There you go.
Sunny day.
All right.
All right,
Thank you very much.
congratulations. You're
Thanks,
welcome.
Thanks again.
I'm Dr. Deuk Majan, CEO and founder of Deuk Spine Institute, Deuk Joint Institute. I'm here with our patient from
Louisiana.
That's right. I had to have him say it. It sounds better when he says it. Why did you come all the way to Florida to the Deuk Spine Institute?
Well, about 3 months ago, I was scheduled for a cervical disc fusion in Shreveport, Louisiana. Had done all the pre-op stuff, was scheduled within 2 weeks to do the surgery, got to work and started doing some research. The more I read about what they were going to do with the fusion, people having trouble with it down the road, above and below the fusion, decided there had to be a better option. So that's when I found Dr. Deuk and his team and started watching some of his videos. Pretty impressive.
And you're a YouTube guy, you were
Yes,
telling
sir.
me, so you found us on YouTube, and what did you think?
Well, our first impression was any doctor that will put his livelihood live on YouTube, showing all of his surgeries, putting it out there, believes in what he's doing. That's not many doctors would do that.
Not just because of that, but because, afraid of complications, which, praise God, we haven't had a complication. We've been doing it now for 17 years. I want people to know there's a safer, better way to take care of their problem other than metal, fusion, stimulators. That's really the message there. You got that message loud and clear.
I did. My surgery was less than 24 hours ago. So far, the tingling, numbing going down my arm is non-existent. It's went away where it was there constantly all the time before. So hopefully this continues on.
Oh, it's gonna continue on. Our results are permanent with the laser surgery. And you can see your tiny little incision right there. It's a 4 millimeter. You can see we went in with a little tube into your disc. I was able to get both discs fixed. You had a lot of herniations in there. Something a lot of people don't understand. They think that a herniation is one piece, but it's about 30 pieces on average. And you had about 30 pieces in each of your discs. They were hard to get to, but we got it done. And I was very happy with the end results. We got all the pressure off the nerves, and we fixed the tear in the back of the disc. Less than 24 hours, here you are. You're doing fantastic. Now, what did your wife think about you coming down here to Florida? Was she supportive?
She was. This problem had been going on for many years. Started out on my right side years ago and had some stuff fixing that, but she knew the problem I was having. I'm very active. I'm a scuba diver, a motocross racer, do a lot of active sports, and she said, we've got to get this fixed. I'm too active still to actually quit all this. I don't want to quit, so this fusion just seemed like it was going to limit my options on doing things. So that's why we come down here. She was very supportive, and we decided to sign up and come on down.
What do you have to say to your insurance company? What do you want them to do?
I sure hope they pay, because I know they would have paid on the fusion deal, but why they would not pay on this, I don't know why, because results are immediate.
And no narcotics?
No, haven't taken a pain pill, haven't taken anything, nothing. Slept like a baby last night.
That's right. And after fusions, a lot of patients end up in pain management. They're getting shots, they're getting pills.
They can't talk, their esophagus is all tore up from them pushing it out of the way.
That's right.
And I have none of that.
Yeah, our patients don't go to pain management because they don't need it. Anything else you want to say to your fans out there?
If you are considering having some type of neck or back surgery, I think you ought to look at Dr. Deuk and his group, because they got a great facility down here, very accommodating. They'll help you with travel, whatever you need. We flew down Sunday, today's Wednesday, and we're going to stay till Sunday. Enjoy a little bit of Space Coast. Hopefully get to see a rocket launch here on Friday morning.
That's right. You can see the rocket launches from here and feel them. All right, sir. It's a pleasure.
Thank you, sir.
My pleasure. You have a great day.
Okay.
Let's get you guys out of here. You got better things to do than to sit in a doctor's
Exactly.
office. And good morning, I'm Dr. Deuk Majan, CEO and founder of the Deuk Spine Institute. I'm here with a patient who has traveled here to have his neck fixed. He had a herniated disc. We did his surgery just yesterday.
Yes, sir.
It was outpatient, Deuk laser disc repair, endoscopic. How do you feel today?
I'd say probably 90 to 95% better, for sure.
Awesome. And what kind of problems were you having before that brought you here?
Severe balance issues, tingling in my arms and fingers. I had pain running down my leg, but I don't have nearly anything today. So big difference.
And your insurance covered your surgery? All right, so we had to cut off that testimonial because we've got a lot of questions. and we want to get to those. And we've just completed 2 discs in the neck through a 4mm incision. This is arthroscopic spine surgery. It's the future of spine surgery for the entire world. It's going to take other surgeons a good 50 years to catch up before you find this everywhere in every continent. There's forces at play, very powerful forces that are keeping surgeons from learning this technology. The most important is the almighty dollar, money, greed, and power. And it really comes down to the fact that, did you see me put any metal in this patient's neck? The answer is no. We didn't put any metal, we didn't do fusion, we didn't put bone graft, we didn't put anything. You see, the spine industry has become dominated by companies that sell metal and plastic and implants for patients to be put into their bodies. And they have infiltrated our educational system, and they're in control of what the doctors and surgeons learn to do. And so they've taken over the entire culture of spine surgery, and they are getting surgeons to do fusions left and right, artificial discs, everything that makes money and puts money in their pocket. This surgery puts money in nobody's pocket, not hospital, not implant company, just the surgeon, the facility where it's being done, and it keeps a lot of money in the patient's pocket, okay? So we've got a long way to go, folks, before this becomes commonplace, and it has nothing to do with the surgery. The surgery is the best results there is out there. It's just there are forces at play that are more powerful than anything I can affect or change. Only you guys can change. And it has to do with greed. So this patient had 2 disc fixed. He did not want metal. He did not want anything stuck in his body that was unnatural. And we just fixed them both, and it went very well. We found many herniations. We sucked them all out through that little tube, or grabbed them out and pulled them out. I showed you a couple of them. But by the time we were done, everything was cleaned out. I expect he'll have a 99% of his pain completely gone permanently the rest of his life. Unless, of course, he doesn't follow my restrictions and does something too heavy or plays some kind of contact sports. Now, he is the horse whisperer. He really is. And it turns out that he was trained as a protege by the actual horse whisperer, where there was a TV show. So, and that's his job. He trains horses. I can't tell you anymore because I don't want to give away his identity. We try to keep everyone's anonymity intact, and you know, some people will share who they are, but that's up to him. All right, let's take the first question.
First question coming from Caroline, once more on Facebook, asking, would you recommend increasing blood flow to the area of the tear post-surgery with acupuncture?
Would I recommend increasing blood flow to the back of the disc to allow healing to happen faster using acupuncture? I'll be honest, I don't know enough about acupuncture. I didn't know it could increase blood flow to the back of the disc, but let me just put it to you this way. If acupuncture,
Yeah.
if acupuncture can increase blood flow to the disc, then I'd recommend it. That's a great point. Yeah, then I'd recommend it.
Next question from Patsy, once more on Facebook, asking, will patients have full mobility of the neck?
Yes, patients will 100% have full mobility. If you noticed, we didn't touch their disc. I mean, we left it intact. We didn't take it out. We didn't fuse it. We didn't put metal. So the natural joint, the natural disc that's there will still be there, okay? And that's where we move, folks. We move our necks between the bones at the disc and at the facet joints. He didn't have a facet joint problem. He asked me, Dr. Deuk, do I have facet pain? I had him turn his neck side to side. He had no pain with the facet movements, and he had no pain with extension. He had just deep axial pain right in the center of the spine. That's your disc problem. He had that. So I left the whole disc intact. I went through with a little straw, went to the back where the herniation was, zapped that out, came out. The disc is still there. He's got normal movement. He's going to have normal movement. And by the way, when you have normal movement after spine surgery, you don't get adjacent segment disease. All right? You get adjacent segment disease with artificial disc, laminectomy, microdiscectomy, fusion. All those invasive surgeries cause adjacent segment disease, but not Deuk laser disc repair. We've never seen it, not in 20 years.
Next question coming from History Enjoyer 2435. Love that name.
I do like History Enjoyer. I have a deep appreciation for history. Go ahead.
asking, how long does pain discomfort from surgery last?
How long does the pain discomfort from surgery last? That's a great question. It depends on what surgery you have done. If you have this surgery, the pain and discomfort from the surgery lasts a few hours. That's it. By tonight, the pain from the surgery will be gone. He'll come back in the morning. I suspect we'll get a nice testimonial from him because I expect that he's not going to have any pain at all. So generally with the Deuk laser disc repair procedure you just watched, no pain after a few hours. And by the way, these patients take 0 narcotic painkillers from our surgery, 0. They take a Tylenol, maybe a Robaxin muscle relaxer, sometimes an anti-inflammatory, just one usually, and they're done. With open spine surgery like ACDF, artificial disc, they're on Percocet narcotics, opioid narcotics for weeks and months after surgery. So the discomfort from this surgery only lasts a few hours and they take no medicine for it. Yeah.
Next question coming from Caroline once more on Facebook, asking, what is the likelihood of this patient getting re-herniated in the same or surrounding areas after the surgery?
Yeah. Caroline, great question. You're asking what is the chance of disc reherniation where we operate? The answer is 1%. That is the only downside to our surgery. It's not a downside because the reherniation rate for other surgeries is higher, but our reherniation rate is 1%. We've now done over 2,000 of these laser surgeries in 18 years. Our reherniation rate is 1%. We've had just over 20 patients. We've had 21 patients with reherniations that required additional treatment. So it is real, it happens, and I could tell you it's almost always happens when the patient is lifting something too heavy or bending over, picking something up from the ground they shouldn't be doing. So as long as you follow my instructions, the chance of reherniation goes down to 0.1%. So 10 times lower than 1%. But our reherniation rate, even at 1%, is still 10 times better than open spine surgery, which is about 10% to 30%.
Next question coming from Bell on YouTube.
Hello, Bell.
Asking, will the DLDR work on cervical discs with myelomalacia? I have herniations at C3 to C6 with iotrogenic kyphosis degenerated by previous surgery, C5 myelomalacia. So is laser feasible, or is this possible, or is this a possible ACDF or PCDF?
Great question. So I'd have to see your MRI first of all. I may have to order a CAT scan to see how much bone there is anterior to the cord. But the Deuk laser disc repair is perfect for any type of disc herniation, disc bulge, protruding disc, ruptured disc, extruded disc, slip disc that you have. This is the best surgery in the world. So yes, we probably can fix your problem with the laser surgery, but I have to see your MRI to be able to know. And I may need a CAT scan as well. But we can do all that through an MRI review. I recommend you get the MRI review. It's free, and you get 10 minutes of my time focused on you and your problems.
Next question from Ian on YouTube.
Hello, Ian.
Asking, do you ever see a trend where an individual gets a laminectomy, for instance at L4, L5, and is a reoccurring patient needing more laminectomies down the road? If so, why do you think this is?
Well, it's a great question, Ian. So I think I understand your question. I'm going to rephrase it just so we can all understand it. I think you're asking me, patients that get laminectomies done, and they keep coming back and getting more and more laminectomies, is that something that I have seen? Mm-hmm. The answer is yes. Is that something in my patients? Absolutely not. And the reason it's not in my patients because I don't need to do that. I don't do that. I fix them the first time, and I don't do a laminectomy, by the way. Laminectomies lead to more surgery. That's why surgeons do them. Folks, you guys are cattle for spine surgeons. I don't know if you realize that. You are the cattle for hospitals, implant companies like Medtronic, Boston Scientific, DePuy, Johnson & Johnson, Alphatech, Nuvasive, the list goes on. There are tons of companies, and you are their food. They're eating you. And the way they do it is they do a surgery that doesn't work. They know it's not going to work. It's not going to last. It may give you a little bit of relief, or they'll just prey on your ignorance and your desperation and being in pain. And they're going to tell you, oh, do a laminectomy, do a microdiscectomy, and that should work. But if it doesn't work, we have other treatments available. Well, first of all, it's not going to work, and if it does work, it's just temporary. The other treatments available are what they're hoping to get to next, because they're making more money on you, and they're going to keep doing treatments. And I've seen patients in treatment for 20 years, 30 years, 40 years, where they've spent out of their pocket $100,000 on services, and the insurance companies have spent $1 million. The average patient in back and neck pain spends $1 million out of the insurance company's pockets. Why? Because treatments that don't work. There is only 2 treatments that work for back pain. One is the Deuk laser disc repair. The other is fusion, and it has to be done properly. It has to be done at all the levels, and it has to be done with the right curvature, the right size graft, the right screws and rods, osteotomies, correction of deformity, avoidance of adjacent segment disease. If you do the fusion right, and there's only about 1 surgeon in every 1,000 that knows how to do it right, you can cure the patient's back pain. You can avoid future treatments, okay? But that's 1 in 1,000 surgeons. Not surgeries, that's surgeons. And I'm one of those surgeons. I know how to do a fusion properly so that it gets rid of people's pain. That said, the laser surgery is far better. Do the laser surgery, avoid fusion. Avoid the recovery, the suffering, the pain, the narcotics, the adjacent segment disease if it happens. Avoid complications that happen with fusion. My point is, very common trend, multiple laminectomies in patients, because our system is screwed up. It rewards doctors for failed procedures, and we have to stop that. And if we stop it, doctors will all be doing the Deuk laser disc repair and the Deuk plasma rhizotomy.
Next question coming from Ian, once more on YouTube, asking, how long would you say pain down the leg is appropriate post-laminectomy?
Ian, how long is pain down the leg appropriate post-laminectomy? 0 days. It should be gone right away. You may find that 5% of patients with chronic pain down the leg from a pinched nerve that is treated with laminectomy, 5% will have pain for a few days after the surgery, maybe 2 or 3 days. That's it. I have never seen pain down the leg after laminectomy after 2 weeks. 2 weeks is the cutoff. And the people that have it at 2 weeks, they have a special kind of pain. It's called nerve root regeneration pain. It's not from the residual stenosis or narrowing. It's from the nerve being crushed so bad before surgery that it swells up and causes edema and swelling, which takes time to go away. So if you don't have nerve root, and that's lightning shock pains, lightning pain in your leg and burning. If you don't have that and you have pain shooting down your leg, the surgeon didn't do the surgery properly. You have residual stenosis and you need more surgery. I would not go for another laminectomy. I would come to Deuk Spine and get the Deuk laser disc repair.
Next question coming from Lanu, once more on YouTube.
Hi, Lanu.
Asking accounting question. Most people don't know your monthly expenses that are extremely high. How do you make sure it doesn't go over the budget?
Lanu, our monthly budget is around $700,000 a month. That's what our bills are. That's an average. Every month is different. Some months we have more marketing expenses, some months we have more salary. It fluctuates. But yeah, our expenses are high, and I worry about it every single month that we're going to make enough money to stay in business, basically. How do you make sure I try to save every dollar I can. I have people turn the lights off in the rooms when we're not in there. We keep the air conditioning set at a level that's affordable. I I just got told my MRI scanner is broken. Apparently there was a power surge. The guy wants $4,000 just to come out and figure out what's wrong. And I'm probably not going to be able to do that because it's too expensive. I mean, he's got to travel from 2 states over, which is $1,000 if he travels nicely and stays in a nice hotel. But why does he need $3,000 times, even if he took 10 hours, why does he need $300 an hour? It's ridiculous. So we have ridiculous costs overhead here. Every hospital does. Every medical center does. Ridiculous. And 90% of those costs are imposed by our government and its regulations and requirements and restrictions. And a lot of that is driven by the insurance companies because they're behind the requirements. They want it to be difficult for doctors to stay in business. They want to put doctors out of business. The insurance companies, the health insurance companies want doctors out of business. They want hospitals out of business. Think about it. They get this money every month from you. It's called a premium, right? And if they don't spend that money that month, they keep it. That's their profit. But if you don't have any doctors for your patients to go to and you don't have any hospitals for them to go to, you're keeping the money because there's no bills. The only thing you're paying are medical bills. So insurance companies want doctors out of business. They want our costs to be ridiculously high, and they've succeeded. When I started in college, 90% of doctors in America were there in private practice. 10% worked for the hospitals. Now 90% work for the hospitals because they can't stay in business. They can't afford to stay in business. They just go out of business. They go bankrupt. So they go work for the hospital. It's easier. Well, the insurance companies love that because now they just negotiate with the hospital. They don't have to negotiate with 500 doctors plus the hospital. They negotiate with the hospital, which employs 500 doctors. It's a crazy system we're in. It's so broken. It's so easy to fix. I could fix it, but I don't want to be the president, and the president won't fix it. You need a lot more support than being just the president. You need the people's support, the public support. And that's why I'm doing what I'm doing, because I believe the public can change what's wrong with the public, with our healthcare system. I can't change it. Only the public can. The people need power, but to have the power, they need knowledge. And I'm trying to give them knowledge, because I may die, in a few years, I'll be gone. But I want the American people to know the truth so that they can start to fix it, because I don't think it's right that people should have to live the way we're living right now. All right.
Next question coming from Nicholas on YouTube, asking, I think this was directed towards me when we were having that conversation with King Smooth. They asked, can I send an email of my MRI of neck?
You can definitely send an MRI of your neck, and we will look at it. But you have to fill out the form.
Yeah.
You have to send it in the right way. There's instructions.
Yeah.
If you don't follow the instructions, we don't look at it, okay? It doesn't work that way. I don't just sit around waiting for MRIs to come in the mail to look at and then call people. It has to be structured the way we do it so that it's efficient for me, so I can see people, help people. Otherwise, I would just waste my time, trying to get in touch with somebody. So it all has to be scheduled. It all has to be properly done the way we've set it up, okay? But yeah, I'd be happy to look at your MRI.
Next question coming from Bell, once more on YouTube, asking, will the DLDR remove calcified thoracic discs at T23 and T10?
No, DLDR will not remove a calcified disc. I rarely have seen a calcified disc, but if you have a rock solid calcified disc in the thoracic spine, my surgery will not remove it. It will not. But it's very rare to see a calcified disc. So if that's your problem, it's very unusual. Most people with thoracic disc problems have thoracic pain. They have pain in the thoracic spine, not a calcified disc. Calcified discs do not cause pain. Calcified discs pinch your spinal cord and cause you to be paralyzed. That's why you need surgery for it. But pain in the thoracic spine doesn't come from calcified discs. It comes from disc herniations and degenerated discs.
Next question coming from Caroline, once more on Facebook, asking, when does a patient know it's okay to go back to regular activities? You mentioned a year. Is there a way to gauge healing?
Is there a way to gauge healing? So the skin will heal in a week. It'll heal in 3 days. Say a week. The muscles and tissues below generally heal in a few days to a week or so. The thing that takes the longest to heal is the disc. There is no way to gauge how fast your disc is healing. It's impossible. There's no test. There's nothing that will tell us. So we just say a year. And from my standpoint, if you have a choice, live in pain the rest of your life for the next 50 years, or take a year and just take it easy, it's a no-brainer. Just take a year and take it easy. Let that disc heal.
Next question from Ian, once more on YouTube, asking, if someone has pain years down the road post-laminectomy, are you or have you ever been able to fix the patient's issue?
Of course. Yeah, Ian, post-laminectomy pain is 100% fixable at Deuk Spine Institute, but not everywhere else. Okay, why is that? If you come to us, we diagnose the source of your pain, we can fix it. If you come to any other doctor in the world, they diagnose the source of your pain and they do what we can do, they will fix it. The problem is they don't know how to diagnose the source of pain, and they certainly don't know how to fix it. So that's your problem. You're running into an issue where the doctors you're seeing have no clue what's causing your pain, and they'll tell you, it's muscle or it's this or that. They have no clue, and they can't fix it. When you come here, we'll be able to tell in 10 minutes what's wrong, and 30 minutes later we could have you fixed without pain for the rest of your life. Okay? That's the difference. That's why we broadcast what we broadcast, is because we're not like everybody else. We're very different. And everybody else is just going to keep treating you to make money off you, but they're never going to fix your problem because they don't know how to, and they believe it's impossible to. We know how to fix your problem. We just need a diagnosis. Once we have the diagnosis, we know what the treatment is. The treatment's easy. We do it all the time. We just got to get a diagnosis.
Next question coming from the classic Carnut on YouTube.
Sure.
Asking, hi, do you think if Tiger Woods came to you first, he would have avoided many of the surgeries that didn't work?
Yeah, 100%. If Tiger Woods would have come to Deuk Spine, and we tried to get him here because he lived in Orlando at the time. He lived in Isleworth. And we even sent a packet to his home. If Tiger Woods would have come to us, we would have saved his entire career. Probably his marriage, his career, and billions of dollars worth of valuation and money. I mean, his career is destroyed. And, the guy was worth like 1.2 billion at the time that his marriage fell apart, right? So I know for sure we could have fixed that guy, and he would still be playing golf, and he'd still be winning. It just breaks my heart to see people's lives destroyed by bad choices, right? People make bad choices all the time. I don't blame him. He is hard to get to, obviously. It's like a top celebrity, but we try to reach out to him, but it's just hard to reach these people. And a lot of these athletes, they're advised by their trainer. The trainer is the guy or gal that works with them and stretches them, conditions them, goes to the gym with them. They have a trainer, right? And the trainer thinks they know what's wrong, and so the trainer is the one who kind of liaises between the athlete and the doctors. And there's just a lot of stupidity out there with pro athletes. Like there's these doctors that are called the team doctor or team surgeon. Most people don't know this, but team surgeons pay 50 to 100 grand, 200 grand a year to be the team surgeon. So they can say, hey, I'm the team surgeon for the Miami Hurricanes. I'm the team surgeon for the Rams. I'm the team surgeon for the Los Angeles Lakers, right? So they'll pay, like LA Laker team surgeon probably pays $1 million a year just to be the LA Laker team surgeon. But they don't earn it with their results. They don't earn it by having good results with the patients. They earn it by paying for it. And then they get that marketing sauce, and that's why they do it. So had Tiger Woods come to me at Deuk Spine, 100%, we would have fixed him with a laser. He'd be freaking killing it on the golf course right now. I could still fix the guy if he's having back pain. But nope, I haven't heard from him. So.
Next question coming from Gina on YouTube asking if someone is getting a DLDR and they get the flu a week before the surgery, will they have to reschedule?
So if somebody's getting our Deuk laser disc repair and they have a flu a week before, no, they do not have to reschedule. If you have COVID and you show up with COVID and you're COVID positive, then we have to postpone until you're asymptomatic for what it was, a week, something like that.
A week.
I don't remember a policy, but it's a standard like CDC policy. So the flu we don't care about as long as you're feeling okay, you know. But if you're coughing a lung up on the day of surgery, we're not going to do your surgery. On the other hand, if you're stable, afebrile, you know, you're doing fine, we're going to do your surgery.
These last two questions, the first one coming from Brad on YouTube asking, have you ever performed an occipital cervical fusion?
Yeah. Hey Brad, have I ever performed an occipital cervical fusion? Yes. I'm a neurosurgeon. We do that kind of stuff. I don't do it much anymore, but I can do it. So an occipital cervical fusion is a very rarely performed surgery. There's very few reasons to do one. It's where you fuse the skull to the spine. And as a matter of fact, I developed the most popular and the best plate, metal plate that bolts to the occipital skull and connects to the rods that go to the cervical fusion. I developed it. It was my idea. I developed it for a company, an implant company, about 16 years ago, and I don't work with that company, obviously. I don't work with any implant companies, really. Alphatech is the only implants I use, but my plate, my design for occipital cervical fusion is used to this day, and it's very popular worldwide as because of the way I designed it.
And then lastly, our question coming from Rich on YouTube asking, Dr. Deuk, what is your procedure for self-pay patients?
Great question. So, Rich, self-pay patients. I don't have a procedure, just so you understand. When people come here, the bills they get from our facility, if they're having a surgery, the biggest bill is the surgery center. It's a facility. It's like paying the hospital. Then there's my bill and there's the anesthesia bill. And our bills are the same. We're both about 5%, or 5% basically. That's the number, 5%. So if the bill is $10,000, $9,000 goes to the surgery center, $500 goes to me, and it doesn't go to me. It goes to pay my bills because I don't get it. It goes to cover the cost of my medical assistants and everything else. But that said, the other $500 goes to the anesthesiologist. So.
And that is it for questions.
All right, great. Great having you all. And I got to get back to seeing patients. We got another surgery. We got more surgery. Our next patient that you guys will see is a single level cervical Deuk laser disc repair. She comes from, I want to say,
Coming from Kentucky.
Kentucky, that's right. She's from Kentucky, and we're doing a single level cervical Deuk laser disc repair for herniated disc. So join us in about 30 minutes.